Welcome back to the channel. My name is Ovi. As usual, I am a nurse who is passionate about mental health and addiction recovery. Today, we are going to be talking about something very, very important, and it affects millions of lives: depression. Whether you are here because of you or whether because of someone you love that is struggling or just want to understand depression better, I'm glad you are watching. Let's dive into the signs, the causes, the treatment, and most importantly, why there is hope. What is depression? Depression isn't just feeling sad. No, it is not. It's not a condition that you just say, oh no, I just feel sad and now I decide not to take care of it. No, it is a medical condition. It affects the way you think. It affects the way you feel. It affects the way you function. It can make your daily tasks feel overwhelming. And it's not something people can just snap out of. No. You cannot just say, oh, I have depression and the next minute I'm okay. No. Depression affects the brain. Chemicals like serotonin, norepinephrine, and dopamine are all involved. These are neurotransmitters. Types of depression. There are several types of depression, but today we're just going to talk about a few of them. The first one is major depressive disorder. This kind of disorder persists for at least 2 weeks. It leads to pervasive low mood, low self-esteem, and loss of interest for at least 2 weeks. Number 2 is persistent depressive disorder, which is also called dysthymia. This kind of depression persists for at least 2 years. The third one is postpartum depression. This depression is related to prenatal depression, also called prenatal depression. It occurs during pregnancy or post-pregnancy. The fourth one is seasonal affective disorder. This kind of depression occurs at seasonal times of the year, at specific times of the year. The fifth one we are talking about right now is depression with bipolar disorder. This kind of depression is the kind of depression that it causes extreme mood swing, most times from maniac to depression. Signs and symptoms of depression. One of such signs is persistent sadness or emptiness. All of a sudden you find out that you are very, very sad. Very sad, very empty. You feel empty. Another sign is loss of interest in things you once enjoyed. You are this person that loves doing, maybe an example, you are this person that loves hiking, or possibly you like cooking. But you now notice that you don't like you don't like hiking anymore, or you don't like cooking anymore. That thing that you love and to do, you find out that you no longer enjoy doing it. Another sign of depression could be changes in sleep. Possibly you are this person who loves sleeping for long hours, but now you find out that you don't sleep no more for long hours. It's not particularly because you are doing something or is planned, but it's just that you just find out that you are no longer doing it no more. You no longer sleep no more for that long hours. Or possibly you are this person who sleep your precise number of hours, and all of a sudden you find out that you are now sleeping more. It could be changes in appetite. You are this person who loves to eat a lot. You are like a foodie. And all of a sudden you find out that you are no longer eating as much. And it's not that you are watching your weight or trying to pay attention to what something or your planned strategy. No. Or even you are this person who does not like to eat. You eat a minimum amount of food, and now you find out that you are eating so much. What are the causes of depression? Depression is complex. It's usually caused by a combination of factors. One of such factors could be biological. Biological could be as a result of brain chemistry or possibly genetics. It could be inherited, yeah. It could also be as a result of hormonal changes. Another form or cause of depression could be psychological. Psychological in the sense that you have low self-esteem, you have a history of trauma or chronic stress. Another sign or another causes of depression could be environmental. It could be loss of a loved one, or financial stress, or even relationship problem. Depression doesn't mean you are weak. It is an illness that can affect anyone. Now, one may ask, how is depression being treated? Depression can be treated. Yes, depression is treatable. And treatment might include medication. Now, when you go see a doctor and the doctor diagnosed you with depression, the doctor may decide to give you medicine. Some of the medicine are either serotonin medications like the SSR or SNRI. Those can also help to balance the chemicals in the brain. Another form to which depression can be treated is through therapy. There's what they call the cognitive behavioral therapy. Yes, another form of the therapy could be interpersonal therapy. Other forms could be through counseling. Another way through which depression can be treated is lifestyle changes. Through exercise, nutrition, good sleep, social support. All this could help in treating depression. Other options could be light therapy, mindfulness practice. All these forms of treatment works best when it is tailored to that individual. How to support someone with depression? If someone you care about is struggling through depression, one of the ways to which you can support that person is listening without judgment. Another way you can support that person is encouragement and helping the person out seek professional help. Another way is you need to be patient with that person, because most times recovery does not occur instantly. It may take time, so you got to be patient. Another form to which you can support somebody going through depression could be you have to check in that person regularly. That person needs your calls, that person needs your text message, and even your visits, possibly if you have some time. Another form to which you can support someone going through depression could be you can offer practical help. Like you can offer meals, you can offer rides, you can even accompany that person to appointments. That all this could go a long way to show support. How do we break the stigma of depression? Depression is common. It is not a weakness. it is not a character flaw. The more we talk about it, the more we can reduce the stigma, the more we can encourage people to seek help, the more we can build supportive community. If you are watching this and struggling, know that you are not alone. Help is out there and recovery is possible. Drop a comment below, whether it's your story, your question, or just to say hello. Let's build a community where we can talk about mental health openly. Don't forget to like, subscribe, and share this video. Someone in your circle may need to hear the story today. Thank you for watching. Stay strong, stay kind, and I will see you in my next one. Thank you.